in terms of challenges met and some of the remaining challenges, I would say, well, first off, healthcare providers on the whole, I think, have done a pretty remarkable job meeting COVID vaccination and infection control requirements in what has been a very decentralized sort of environment. And I'll add that, I think these same providers, again, on the whole, have been managed to comply with the guidance that's coming out of the federal, the state, and local authorities around employee and patient safety, isolation. As you know, there's lots of things over the last couple of years around no communal dining, no group therapy, et cetera. And there's just been a ton of training, and then of course, a real burden placed on employees and staff and providers around patient notification, family notification, no small feat. And then I would add that telehealth has been a real success, right? I mean, it's a critical intervention at a time when you had a lack of caregivers, in part because so many of them were getting COVID, and you had patients that were isolated and couldn't be seen outside of their room. So it was fortunate that the government did approve that modality and pay for it. In terms of remaining challenges, I would say there's quite a few, but I'll focus on just a couple. The first being that there really is, as far as I'm concerned, there hasn't been any real resolution to the inconsistent and often conflicting guidance that we're seeing from federal, state, and local authorities. And you take PPE supplies and distribution, during COVID, it was chaotic, sort of an eat what you kill kind of environment. And it's still very unclear to me, and I think many of my peers in the sector, about how this is going to get resolved if we have another pandemic or another surge. Is there going to be more centralized control? And then one thing I really want to focus on is there remains significant patient care challenges, on the heels of COVID. And I say that knowing that the numbers are ticking back up. As we look at the patients that we're caring for who have been isolated for so long, we're seeing declines in mobility, declines in ADLs and functional status. Falls are significantly up because a lot of these patients haven't been walking around and haven't been very mobile over the last couple of years. And then, of course, you got to deal with all the depression and mental health issues that come out of the lack of socialization and the isolation policies. So we're at a time, all this is happening at a time that CMS continues to, slash reimbursement. And it's hard to reconcile the two. You have, patients who need more care at a time when there's less funding to attract and retain critical caregivers. So I think that's an issue. And the last thing is, there is a real issue around employee burnout. I mean, a couple have talked about that already, and we'll get into that more when we talk about the labor shortage. So, that's what I would say.